dreams and transferences, and the therapist's interpretation of these previously repressed feelings, allowing the patient to gain self-insight. Basically, it talks about how there's a certain type of therapy known as, there are different types of therapy, and it's one of the methods, for example, called free association, where what they do is they'll have you sit in like a chair or on a couch or something. They'll have the therapist on the other side of the room, like out of your point, out of your field of view, but you're supposed to just like speak whatever comes freely to your mind. They're supposed to like write this down and interpret it and things like that, and certain things called resistances, which are basically like your little mental blocks, because you don't want to say something because it feels like it's irrelevant or you feel shameful saying it. They like to write those down too, and they want to try and figure out what the cause of these resistances, or they want to figure out what the cause of these resistances are, or why is it that you say the things that you say. And then also what they do is they'll interpret these resistances, like, oh, he doesn't like talking about his father. Maybe his father wasn't around when he was a kid. Maybe his dad used to beat him with his And also there's some transference, which is related to interpretation, which is essentially where the therapist takes, let's say you have from like what the therapist got from what you're saying, you had a similar relationship with your, or no, that's something else. Okay, transference is the therapist taking how like the emotions that you feel as these are starting to rise from the surface, and they're the emotions you feel towards them, how they interpret these emotions and take them in. So, oh, he's getting mad at me while we talk about his old cousin. Or maybe his cousin used to always get mad at him, or maybe he used to want to get mad at his cousin, but his cousin would beat him up when he got mad at him. So the therapist interprets your emotions. Psychodynamic therapy, it's psychoanalysis therapy, the free association, laying on the couch. So it's a type of therapy. I guess it's one of the more, it's pretty effective, but the thing is it takes a lot of time and it's really expensive, where you have to go like multiple times a week and you have to do it for a couple years before you truly get like the effects. And for example, there's a quote in the book, a price quote, 3 times a week for this 2 years at more than $100 an hour, it comes out to at least $30,000. So you have some money to do this type of therapy. Psychodynamic therapy is a type of therapy where, unlike free association, where they want to go back to when you were a kid and things like that, this one wants to focus on your current relationships that you have right now and talk about, why is it, they wants to talk about your relationships or your current emotions that you have right now and how they can work on fixing those to make you a better person today, versus a free association wants to go back and find the roots and figure out why is it that this happened, why that led to this, things like that. So it talks about this psychodynamic. It's like the most common kind in the book. It shows a picture of a guy sitting in a chair across from his therapist, and he's just directly talking about, how he feels about things going on in his life right now, or what's going on in his life right now. The therapist talks about it. And then variation, or like a splinter of psychodynamic therapy, is interpersonal psychotherapy, which essentially what they do is you go to a therapist for a brief, short time, 12 to 16 sessions generally. You talk about one specific problem you have at the time, or one specific set of problems that you want to get off your chest, and the therapist is going to work on fixing those current emotions and that current problem, and they're not there, work on really anything but that. So the book gives an example about a 34-year-old woman who, after getting a promotion, she wanted to have a new child, and her husband, I guess, wasn't with having a new child, so she goes to this, starts seeing this therapist, and he talks to her about, balancing her work, her new promotion, this new workload with that, with her husband, with her already kid she has, with balancing and talking to her husband about having a second child. So the therapist doesn't talk to her about, why maybe her husband doesn't like having the idea of a second child because of his past. She just talks about worrying about the specific problems at hand and keeping your life balanced and things like that.
Okay.
Right, talk fast, but he already did 1 second, so he's trying to rush to get to the end of this.